Good afternoon to all the esteemed judges, guests, and respected doctors and fellow medicos. So I'm Rajdeepsinh Gohil, a second year medical student, currently pursuing from Kiran Medical College, and so my topic is suicide among medical students. So this is a very critical question that needs to be asked: that are they really suicide? So people say that suicide is a personal choice. So is it really a personal choice, or is it driven by a career that demands perfection but offers nothing in return? So this is the data. So 64% there is increase in overall students of suicide rates. So an activist, student activist, Dr. Vikas Pandey, he filed an RTI, and NMC, this is the reply that NMC gave. So at least 122 medical students committed suicide, and 1270 dropped out in the last 5 years. Here the catch is in at least. After this thing, there was a survey conducted by All India Institute of Medical Sciences, and in which they said that the shocking figures that we just saw was just the tip of the iceberg. So this is where we need to see that is it the negligence of National Medical Commission or the society entirely. So we all know the causes that are most common, that exaggerated duty timings, ragging and bullying cases, these are common. But what are the flaws that are hidden from us? So Dr. Rohan, who is the chairman of Federation of All India Medical Association, he said that the punitive system discourages students from dropping out. So how do they do this? So the seat leaving bonds that we have. So if a student is from an economically backward background, then under toxic condition he won't be able to drop out. We consider that it is important in order to maintain the value of the medical seat, but is it more important than a life? So these were some reasons to consider systemic failure. Now further I would like to focus more that all the suicides, most of the students that commit suicide are severely depressed or severely anxious. So if that is so, then why do not they seek treatment? So this was a research that was done, and the result in which 65% of them strongly agree is that if they even thought that they needed to see a psychiatrist, they thought that they worried that what would their classmates think or what would their faculty think. So this is still a stigma which we need to change out. So that is what I think, that where vulnerability is seen as weakness, in this situation there is more chances to commit suicide. So that is what I think, and I think the label matters, because putting the blame on the individual who committed suicide is not the option. So I think using terms like deaths due to systemic failure shifts the focus to need for change, and if a mental health problem should be seen as any other problem. If I have asthma or if I have any renal stone, I would be able to communicate it to the doctor very easily. But I would find it difficult if in this society to tell that I have some mental issues, I have some emotional issues, and I am unable to tackle it alone. So this is what I think. Thank you.